Vapes, those small, sleek pieces of technology that turn flavored liquid into an inhalable cloud. Usually they contain nicotine. Sometimes they taste like mangoes, gummy bears, or desserts your dentist has warned you about and you have repeatedly ignored. These devices go by many names: vapes, e-cigs, vape pens, and they range from things like cigarette lookalikes to gadgets that resemble USB drives or gaming tech. What they all share is a promise: something new, something modern, and something that is supposedly safer. The promise of safer helped vaping spread quickly when it was first introduced, especially after brands like Juul took over the market and turned vaping into something compact, discreet, and for many young people, startlingly normal. Here's where things get interesting. Some adults have turned to vapes instead of cigarettes. However, millions of teens have also started taking them up as well. They are drawn in by flavors, coolness factors, and even smart vapes that can play music or connect to phones. As a result, schools, parents, and regulators have found themselves in a game of technological whack-a-mole. So where does that leave us? Vaping sits at the intersection between public health, personal choice, and very good marketing. It's raising questions about addiction, safety, and how we protect kids without ignoring adults who are trying to quit smoking. So, is vaping a harm reduction tool or just a new way to get hooked? We are going to go over both perspectives one at a time. First, we'll cover the pro-vape perspectives and then the anti-vape viewpoints. Try to keep an open mind. You'll probably learn something new. Let's get started. Boop. Perspective number one. Vaping helps people quit smoking and lowers youth smoking rates. Every cigarette is a small theft from the future of a smoker. Those minutes spent smoking add up quickly and can lead to literal days lost each month, which is just one of the many reasons why quitting matters so much.
Nicotine patches, chewing gum, mint as well, didn't work for me. It's been 7 months now, so I haven't had a cigarette since then.
This man's story is backed up by the evidence, which suggests that smokers who turn to vaping are far more likely to kick the habit. According to Peter Hajek, who is a professor of clinical psychology, smokers who switch to vaping remove almost all the risks smoking poses to their health. E-cigarettes outperform other methods like gum or patches and dramatically increases the likelihood that someone will actually quit smoking. The opposing side would like to point out that they are so effective that many people who were never smokers in the first place took up vaping just for kicks, but more on that later. This shift to e-cigarettes removes nearly all of the health risks that come with smoking traditional cigarettes. You know what's not a health risk though? Being the absolute coolest cat in town. Additionally, youth smoking has collapsed to historic lows since vaping's arrival. This has given public health the rare story in which fewer people are lighting up and more are choosing to live cigarette-free. Perspective number two. Vaping is a safer way to ingest nicotine than smoking cigarettes. The UK reports that e-cigarettes are 95% less harmful than a regular cigarette. According to Matthew Carpenter, who is a cancer center researcher, combustible cigarettes are the most harmful form of nicotine delivery. The average cigarette causes lots of bad things like lung cancer, heart disease, and stroke. Also, e-cigarettes are better on the indoor front. Vapes leave about 200 times less nicotine buildup on surfaces, which is great because that buildup can turn carcinogenic. Switching to e-cigs reduces toxins and carcinogenics. We know this for sure. Excuse me, sir, did you know that your cigarette lets out carbon monoxide and gets tar all over the place? Yeah, sure, dude. You think heating things up in a plastic tube and inhaling it is going to have no long-term effects? Have you even heard about all the other things and harmful chemicals and toxins that are released when people vape that are just as bad, if not worse, than regular cigarettes? Perspective number three. Vaping lowers healthcare costs for everyone. Sally Sattel is a psychiatrist specializing in addiction, and she said, getting more smokers to switch would result in significant cost savings, as well as almost 500,000 lives saved each year. It drains billions of dollars from healthcare and productivity each year, and at the same time cuts lives short by the hundreds of thousands.
Smokers are stopping smoking. This is definitely a good news, and importantly, this is all happening without any government expenditure.
Advocates argue that helping smokers switch to e-cigarettes could save nearly 500,000 lives annually, while easing this enormous economic burden, a rare case where compassion and cost-effectiveness point in the same direction. In that sense, vaping is framed as a disruptive technology, not just of markets, but of mortality, creating jobs while quietly undoing some of the damage that cigarettes have done. That was the end of my pro-vape perspective. It's brief interlude time. This topic is divisive. I'm trying to remain neutral, but it's not easy. If we get to the end of the video and you don't know what my personal opinion on the topic is, a like on the video would be so sweet. Back to you, Bob. That guy's trying too hard. Brief interlude time over. It's time for the no vapes perspectives. Waka-pow! Perspective number 1. The health risks of vaping are different, but just as concerning as smoking risks. Vaping is often framed as a safer detour, but the evidence keeps circling back around to the risks. Vaping brings higher odds of stroke, heart disease, toxic metal exposure, fertility disruption, and brain effects we are only beginning to understand.
A disturbing new report linking concentrated toxins to some of the most popular vaping devices in America.
Stephen Broderick, who is a surgeon at Johns Hopkins, says, "We're seeing a rash of collapsed lungs in young people. We always ask if they've been smoking, and they'll often say, 'No, I don't smoke, but I do vape.'" Researchers warn of chemicals that go from benign to carcinogenic when heated up, and public health groups note that many smokers who vape don't quit at all. They simply add in vaping when smoking wouldn't be appropriate. The AHA has concluded bluntly, the science clearly indicates vaping is not a safe or healthy alternative to smoking. Perspective number 2. E-cigarettes can catch fire and explode. These devices that are small enough to fit in your pocket often explode, causing serious bodily injury, maimed faces, serious burns, and in some cases, the people using them have died.
That extra battery that I had in my pocket exploded down my leg. I suffered 3rd-degree burns on 20% of my body.
Emergency rooms, airlines, and fire officials all tell similar versions of the same story. Lithium batteries being used to heat things up in a tiny container is a recipe for disaster. In reference to hundreds of acute injuries, the USFA has stated, "No other consumer product that is typically used so close to the human body contains the lithium-ion battery that is the root cause of the incidents." Excuse me, did you know that vapes are extremely dangerous and can blow your face off if you're not careful? Do you know how many millions of vapes are in use every day? It's like saying you shouldn't drive EVs because they also catch on fire. Also, how much of that is due to like user error or like people storing them in a hot car that isn't okay? Moving on. Perspective number 3. Disposable vapes and cigarettes are both bad for the environment. Legally, vapes aren't even supposed to be thrown in the trash because the nicotine e-liquid contains formaldehyde and other heavy metals. And yet, vapes are designed to be disposable, so they are making their ways into landfills and waterways. Billions of disposable vapes and trillions of cigarette butts have accumulated in landfills. Counterpoint from the vape people. Sure, they are bad, but vapes are the lesser of two evils. And if everyone made the switch and it was only vapes being thrown out, we would all be in a better position. Lucas Gutterman of the USPIRG called single-use vapes wasteful, harmful, and trending. It's a reminder that some habits don't just borrow time from the individuals, they mortgage the environment that we all share. Well, that's all she wrote, folks. You have been given the basics of both sides of this discussion, so remember, with great edutainment comes great responsibility. If you weren't able to discern that my own personal opinion on this topic is that I am strongly anti-vape, then now is the time to like the video. If you have any thoughts on this topic or you saw something I missed, please feel free to throw it at me in the comments. If you are already subscribed, you are a happy vape on a shelf ready to give someone a collapsed lung. And if not, you are a vape in the back pocket of someone who's about to have their lung collapse. As always, keep your towel close, your friends closer, and I will see you in the next video. Peace.